12 weird signs you have liver damage and how to reverse it. Welcome to Primetime Health, where we explore cutting-edge health tips and natural remedies to help you live your healthiest life. If you've ever wondered if your liver could be in trouble, or if you've been dealing with persistent health issues, today's video is for you. We're diving into the 12 weird signs that you may have liver damage and what you can do to reverse liver damage naturally. The liver is one of the most resilient organs in our body, and with the right steps, it has the ability to heal itself. But recognizing the signs early is crucial to preventing long-term damage. Stick around until the end, as we'll also discuss the natural remedies that can help your liver recover and thrive. Let's dive in. Understanding liver damage. The liver is one of the most vital organs in your body. It's not only responsible for filtering toxins from the blood, but also for processing nutrients from the food you eat and producing proteins that are essential for a variety of bodily functions. It's a workhorse, tirelessly processing and detoxifying, often without you even realizing it. But when the liver becomes damaged, whether due to alcohol abuse, a poor diet, excessive sugar, viral infections, or autoimmune diseases, its ability to function properly begins to diminish, which can have a significant impact on your overall health. Research shows that about 25% of adults in the U.S. are living with some form of liver disease, and many of them don't even know it. Unlike other organs, the liver has an incredible ability to regenerate and heal itself. However, this remarkable ability is not infinite. If damage continues unchecked, the liver can become permanently scarred, leading to conditions like cirrhosis, fatty liver disease, or even liver failure. But here's the good news. Early intervention can help reverse some of the damage and stop it from progressing further. One of the tricky parts about liver damage is that it doesn't always come with obvious symptoms. Unlike a cut on your arm or a headache, liver problems often progress silently. By the time symptoms appear, the damage could be more severe, making early detection crucial. The liver is a silent sufferer, which means it's important to be aware of subtle signs that could indicate something is wrong. In the next sections, we'll dive into 12 weird signs that might indicate that your liver is struggling. These signs could be easy to overlook, but if you catch them early, you could help prevent further damage and give your liver the best chance to heal. So, if you're experiencing any of these symptoms, it's important to consult a medical professional for further tests and evaluations. Remember, the sooner you catch liver problems, the better the chances for recovery. Let's begin by exploring some signs that may seem completely unrelated to liver function, but could actually point to something deeper going on inside your body. These are the early warning signals you should not ignore. Number 1. Pale stool. One of the first things you might notice when your liver is struggling is a change in your stool. Normally, your liver plays a crucial role in digestion by producing bile, a digestive fluid that helps break down fats in the food you eat. This bile is what gives stool its typical brown color. However, when the liver becomes damaged, as in the case of fatty liver disease or cirrhosis, the flow of bile can become obstructed or reduced. When bile is not produced or is blocked from reaching the intestines, it impacts the digestion of fats and leads to pale stools. These stools can turn clay-colored or even appear almost white. Sometimes, due to the undigested fats, the stools may even become buoyant, floating on the surface of the toilet water. This is a clear sign that something is wrong with your digestive system, and it may indicate liver dysfunction. A change in stool color is one of the more obvious signs that your liver may not be functioning properly. If you notice that your stool is unusually pale or floating, it's essential to take action quickly. This could be a sign of liver damage that needs immediate attention. Consulting with a healthcare provider and getting a proper diagnosis is crucial, as the underlying liver condition may worsen if not addressed. The liver is one of those organs that, when damaged, often shows subtle signs before the major symptoms of disease arise. If pale stool is accompanied by other warning signs, such as fatigue or abdominal discomfort, it's even more important to seek medical advice. Early intervention can help prevent the progression of liver disease and allow your liver to begin healing before the damage becomes irreversible. Number 2. Poor night vision. Nyctalopia. A surprisingly early sign of liver damage can be poor night vision, also known as Nyctalopia. You might notice it becoming increasingly difficult to see clearly in low light or in the dark, which is not just a normal sign of aging. The liver plays a critical role in the metabolism of vitamin A, a nutrient essential for healthy vision. When your liver is functioning properly, it produces a protein called retinol-binding protein, which is responsible for transporting vitamin A to the retina, the part of your eye that helps process light. When the liver becomes damaged, it struggles to produce this protein, leading to a vitamin A deficiency. Without enough vitamin A, the cells in the retina that help with low-light vision can't function effectively. This deficiency can result in poor night vision, making it difficult to navigate in dimly lit environments or drive at night. If you've noticed this type of vision change, it could be an early indicator that your liver is compromised. While poor night vision is often linked to aging or other eye conditions, when it occurs alongside other symptoms of liver issues, it becomes a red flag. Difficulty seeing in low light or blurry vision in the dark could mean that your liver is not processing nutrients properly, which in turn affects your vision. If you're experiencing these symptoms, it's important to consult with a healthcare provider, as addressing the liver issue early can prevent more severe vision problems and liver damage in the future. In many cases, liver damage can go unnoticed for years, as it doesn't always present with clear symptoms. But night vision issues could be one of the first signs of liver dysfunction. A doctor can perform a thorough evaluation and run tests to determine if your liver health is contributing to your vision problems, helping you catch potential issues before they become too serious. Number 3. Swollen right foot. If you notice swelling in your right foot, this could be a sign of peripheral edema, which is often associated with liver damage. The liver plays a crucial role in regulating fluid balance in your body, particularly by producing albumin, a protein that helps maintain the correct pressure to keep fluids inside your blood vessels. When the liver becomes damaged, it struggles to produce enough albumin, which leads to an imbalance in your body's fluid regulation system. As a result, fluid begins to accumulate in the tissues, causing swelling, especially in the lower extremities like your feet, ankles, and legs. This swelling can be more pronounced on the right side of the body, due to the way blood flows through the liver. When the liver isn't functioning properly, it disrupts the circulation of blood, leading to the buildup of fluids in the legs and feet, particularly on the right side. This swelling is a warning sign that your liver may not be performing its essential functions, such as protein production and fluid regulation. While swelling can occur for a variety of reasons, persistent or unexplained swelling in one foot or leg should not be ignored, especially if it's accompanied by other symptoms like abdominal pain or fatigue. If you experience persistent swelling in your foot, particularly on the right side, it's important to consult a healthcare professional as soon as possible. This could be an early sign of liver damage that needs immediate attention to prevent further complications. With proper care, it's possible to treat liver damage before it becomes more severe, so early intervention is key. A doctor can run tests to evaluate liver function and determine whether the swelling is linked to liver disease. Number 4. White or yellow bumps around the eyelids. Xanthelasma. Another unusual but significant sign of liver damage is the appearance of white or yellowish bumps around the eyelids, known as Xanthelasma. These bumps are cholesterol deposits that form under the skin, typically around the eyes. When the liver is damaged, it becomes less efficient at processing cholesterol, causing it to build up in various parts of the body. This excess cholesterol can accumulate in the eyelids, leading to the formation of these distinctive yellow or white patches. Normally, the liver helps regulate cholesterol levels in the blood. But when the liver is not functioning properly, whether due to fatty liver disease, cirrhosis, or other liver conditions, it can no longer break down cholesterol as effectively. This inefficiency results in the cholesterol being deposited in places like the eyelids as the body struggles to remove it. These yellow or white bumps can vary in size and number, and while they may not cause pain, their presence should not be ignored. Xanthelasma can be an early indicator of liver disease, particularly when these deposits appear without any known cause, such as diet or genetic predisposition. If you notice these yellowish bumps forming around your eyes, it's important to seek medical advice. Xanthelasma could indicate that your liver is not processing fats properly, and it may be a sign that a more serious liver condition is developing. In many cases, the appearance of xanthelasma can be treated either through dietary changes, medications, or sometimes surgical removal. However, it's crucial to address the underlying cause, the liver damage, to prevent further complications. If you see these signs, consult a healthcare provider for a proper diagnosis and treatment plan to prevent further liver damage and manage cholesterol levels effectively. Number 5. Right-sided pressure. One of the more uncomfortable and often overlooked signs of liver damage is a sensation of right-sided pressure or discomfort, particularly after eating. This sensation often originates from the upper right quadrant of your abdomen, where your liver is located. The cause of this discomfort is typically related to the thickening of bile in the liver, which occurs when the liver is unable to process bile properly. This thickened bile can cause a sludge to accumulate in the bile ducts, which can block the flow of bile and disrupt the normal digestive process. When bile is not flowing freely, it creates pressure in the liver and surrounding areas, leading to discomfort in the right side of the abdomen. This discomfort can intensify after eating, especially after consuming fatty or heavy meals that require bile for digestion. In some cases, the discomfort may even radiate to your right shoulder, a symptom that is caused by the involvement of the phrenic nerve, which runs from the diaphragm to the shoulder. When the liver is under pressure, it can irritate this nerve, causing pain or tightness in the shoulder. The sensation of pressure or discomfort on the right side after meals can be a sign that something is wrong with your liver and its ability to properly produce and process bile. It's important to pay attention to these sensations, as they may be indicative of fatty liver disease, liver cirrhosis, or other liver-related conditions. If you experience persistent pressure, pain, or discomfort in this area, especially after eating, it's essential to consult a healthcare professional for an evaluation. Ignoring these signs can lead to further liver complications, so getting checked early can help prevent the progression of liver damage and ensure that you receive the appropriate treatment. A healthcare provider may recommend tests such as ultrasound scans or blood work to determine the extent of the liver damage and offer treatment options to help relieve the pressure and improve liver function. Number 6. Purple or red bumps on skin. One of the more alarming signs of liver damage that may not be immediately obvious is the appearance of purple or red bumps on the skin, often referred to as petechiae. These small, round spots can appear on the arms, legs, or lower extremities and are caused by broken blood vessels just beneath the surface of the skin. When your liver is damaged, it struggles to produce essential proteins like fibrinogen, which are vital for the blood clotting process. Fibrinogen plays a crucial role in helping your blood clot properly, so when the liver is not producing enough of this protein, it becomes harder for your body to stop bleeding or heal wounds. As a result, easy bruising and the appearance of petechiae can occur, even after minor bumps or pressure on the skin. The skin may show clusters of small purple or red dots that can look like rashes but are actually a sign of poor blood circulation and an inability to maintain normal blood clotting processes. The presence of these purple or red bumps on the skin is often an indication of advanced liver damage. When liver function declines, it leads to poor circulation and the accumulation of toxins in the blood, which can further contribute to the appearance of these spots. This can be a sign of conditions like cirrhosis or liver failure, both of which significantly impair the liver's ability to produce essential proteins and maintain normal blood clotting. If you notice these purple or red bumps appearing on your skin, especially if they are frequent or not linked to any recent trauma, it's important to consult with a healthcare provider. A doctor will likely recommend tests to assess your liver function and determine whether there's an underlying liver condition contributing to the skin symptoms. Early detection and treatment can help prevent further liver damage and improve your blood clotting function. Number 7. Cracked heels. If you've noticed your heels becoming cracked or your skin becoming excessively dry and flaky, this could be an unexpected sign of liver damage. The liver plays an important role in storing essential vitamins like vitamin B3, niacin, which is crucial for keeping your skin healthy and hydrated. Vitamin B3 helps in maintaining the moisture and elasticity of your skin. However, when the liver becomes damaged, it may begin to deplete its reserves of vitamin B3 in an attempt to heal itself. This depletion can lead to a deficiency of vitamin B3, which affects the health of your skin, causing it to lose moisture and become increasingly vulnerable to damage. As a result, the skin on your heels and the soles of your feet may become particularly dry, cracked, and rough. Cracked heels are not only unsightly, but can also lead to painful fissures in the skin. In more severe cases, the skin may even start to bleed, making it more susceptible to infections. Liver damage, especially in conditions like cirrhosis or fatty liver disease, can interfere with the body's ability to properly metabolize and store vitamins and nutrients, leading to a deficiency in essential compounds like vitamin B3. When your liver isn't able to perform its job effectively, the effects can show up on the surface of your skin, especially in areas that are more prone to dryness and irritation, like the heels. If you're experiencing chronic dry skin or cracked heels, it's important to pay attention to other signs of liver dysfunction that may accompany this symptom. Dry skin can also be linked to poor circulation and toxins accumulating in the body, both of which can be caused by liver damage. Consulting with a healthcare professional is essential if you're experiencing these skin issues, as they may be connected to liver health. In addition to treating the skin symptoms, your doctor may recommend tests to assess your liver function and help prevent further complications. Taking early action can help improve your liver health and, as a result, restore moisture and elasticity to your skin. Number 8. White or swollen nails. One of the more subtle yet telling signs of liver damage can be seen in your nails, specifically white or swollen nails. In the 1950s, a study found that 8 out of 10 individuals with severe liver cirrhosis had completely white nails, a condition that's now known as Terry's nails. This change in nail color is usually the result of poor blood circulation and a lack of oxygen in the body, both of which can be associated with chronic liver disease. Terry's nails typically appear white, with a narrow pink or brown band at the tip, which may indicate that the liver is no longer effectively processing nutrients or oxygenating the bloodstream. This discoloration occurs because the liver's dysfunction impedes its ability to produce vital proteins and maintain blood flow, leading to an oxygen deficit that affects the nails. In addition to Terry's nails, another sign of liver dysfunction can be clubbing of the nails. Clubbed nails are characterized by rounded, swollen fingertips and nails that become curved and shiny. Clubbing is often a sign of chronic hypoxia, where the tissues don't receive enough oxygen, which can be a consequence of severe liver disease. This condition not only affects the liver, but can also signal other systemic issues, such as problems with lung or heart function, which often accompany liver disease. If you notice white, swollen, or clubbed nails, it's important to consider this as a possible sign of liver dysfunction. Nail changes can often go unnoticed until they become more severe, but they may be one of the first visible indicators that something is wrong with your liver. If you observe these symptoms, along with other signs like jaundice, abdominal pain, or fatigue, it's essential to seek medical attention. A doctor can perform liver function tests, such as blood work or ultrasound scans, to determine if the liver is the cause of these nail changes and provide you with a treatment plan to address the root cause of the issue. Catching liver disease early is key to preventing further damage, and addressing it while symptoms are still mild can help improve the prognosis and even reverse some liver damage. Number 9. Dark urine. One of the most noticeable signs of liver dysfunction is dark urine. If your urine appears dark yellow, amber, or even brown, it may indicate that your liver is having trouble processing waste products. Under normal circumstances, your liver filters bilirubin, a yellow pigment produced during the breakdown of red blood cells, from your bloodstream. The liver then excretes this bilirubin into the bile, which helps in digestion. However, when the liver is damaged, whether due to conditions like hepatitis, cirrhosis, or fatty liver disease, it may struggle to process and eliminate bilirubin properly. When the liver can't efficiently break down bilirubin, it begins to accumulate in the bloodstream. This excess bilirubin is then excreted through the kidneys, which can cause the urine to turn a darker color. Dark urine is a classic symptom of liver issues because it indicates that bilirubin is being released into the urine instead of being processed normally. It's often a key sign that the liver is not functioning as it should. If you notice that your urine has become darker than usual, especially if it is accompanied by other symptoms like fatigue, yellowing of the skin, jaundice, or abdominal discomfort, it's important to consult a healthcare provider. Dark urine, while it may seem like a minor issue, could point to serious liver problems that need to be addressed right away. A healthcare professional can perform blood tests or imaging studies, such as an ultrasound, to evaluate liver function and diagnose the underlying issue. Addressing liver problems early is crucial, as untreated liver dysfunction can lead to irreversible damage and more severe health complications. So, if you notice dark urine, don't ignore it. Seek medical advice to rule out liver disease and take proactive steps to protect your health. Number 10. Jaundice. Jaundice is one of the most recognizable and serious signs of liver damage. It occurs when bilirubin, a yellow pigment produced from the breakdown of red blood cells, accumulates in the bloodstream because the liver is unable to process it properly. Under normal conditions, the liver filters out bilirubin and excretes it through bile, which aids in digestion. However, when the liver is damaged, whether by fatty liver disease, cirrhosis, hepatitis, or other liver conditions, it can no longer efficiently process and remove this pigment, leading to its buildup in the blood. As bilirubin levels rise, it starts to accumulate in the skin, eyes, and mucous membranes, causing a noticeable yellowing. Yellow skin and yellowing of the eyes, known as scleral icterus, are the hallmark signs of jaundice. In more severe cases, even the mucous membranes, such as the inside of the mouth, may take on a yellowish tint. Jaundice is not just a cosmetic issue, it's a clear indication that the liver is struggling to function, and it usually points to a more severe underlying liver condition. Jaundice is particularly common in advanced liver diseases like cirrhosis, where the liver becomes scarred and its ability to filter bilirubin diminishes. It can also occur in conditions like hepatitis, where liver inflammation disrupts its function. If you notice any yellowing of the skin or eyes, it is critical to seek medical attention immediately. This could signal a serious liver condition that requires prompt diagnosis and treatment to prevent further damage or complications. While jaundice itself is a sign of liver distress, it is often accompanied by other symptoms such as fatigue, abdominal pain, and dark urine. If you experience jaundice along with these other signs, It is especially important to get checked out by a healthcare provider who can assess liver function through blood tests, imaging, and other diagnostic tools. Early intervention is key to managing liver diseases and preventing more serious issues, including liver failure. Number 11. Spider veins. Spider veins, small, dilated blood vessels that appear just beneath the skin, can often show up on areas like the face, legs, or feet. These veins typically appear as a web-like network of red, purple, or blue lines, which is where the name spider veins comes from. While they are often considered harmless, the appearance of spider veins can sometimes indicate liver dysfunction, particularly in cases where the liver is struggling to break down hormones properly. When the liver is damaged, especially in conditions like cirrhosis or hepatitis, its ability to metabolize hormones like estrogen is compromised. Elevated estrogen levels, which the liver normally processes, can lead to vascular changes in the body. One of the most noticeable being the development of spider veins. These veins can appear as a result of increased blood flow to the skin's surface, caused by the imbalance in hormone processing. Spider veins are a sign that the liver is not functioning as efficiently as it should be, and they can be indicative of more serious liver conditions. While they might seem like a cosmetic issue, their presence, especially if accompanied by other symptoms such as swelling, fatigue, or abdominal discomfort, should not be ignored. If you begin to notice spider veins forming, especially if you have a history of liver disease, it's important to monitor their appearance closely and consult a healthcare professional. Early detection of liver dysfunction can help prevent further damage, and addressing the root cause can help improve the overall function of your liver. A healthcare provider can perform blood tests and imaging to assess your liver health and provide treatment options if necessary. Number 12. Itchy skin. Itchy skin is a frequent and often overlooked symptom of liver damage, particularly when caused by a condition known as cholestasis. Cholestasis occurs when the liver is unable to properly process and excrete bile, a digestive fluid that helps break down fats in the body. As a result, bile acids begin to accumulate in the bloodstream and deposit under the skin. This buildup causes intense itching, which can become quite uncomfortable and persistent. The itching associated with liver damage is often worse at night, disrupting sleep and making the skin more sensitive to touch. The sensation of itching can be widespread, affecting large areas of the body, or it can be localized to certain spots. In more severe cases, the skin can become dry, flaky, and irritated, further compounding the discomfort. If this symptom persists or worsens over time, it is a strong indicator that there may be something wrong with the liver's ability to process bile and toxins. In addition to cholestasis, itchy skin can also be associated with cirrhosis or other liver diseases where bile flow is impaired. The accumulation of bile acids in the bloodstream not only causes the skin to itch, but also leads to inflammation and irritation. The liver, which normally works to filter toxins from the blood, becomes overwhelmed, and these toxins can then manifest on the skin's surface. If you experience persistent itching or notice that it worsens at night, especially if you have other symptoms of liver dysfunction, such as dark urine, yellowing of the skin, or abdominal discomfort, it's important to consult with a healthcare provider. This symptom should not be ignored, as it may indicate a need for a liver health evaluation. In many cases, treatment for liver damage, coupled with lifestyle changes and medication, can help alleviate the itching and address the underlying liver condition. Early intervention can help prevent further complications, improving both skin health and liver function. How to reverse liver damage. If you've been concerned about your liver health after learning about the signs of liver damage, you'll be glad to know that the liver has an incredible ability to regenerate. However, this remarkable organ requires the right care and proactive steps to restore its function and prevent further damage. Here are several natural ways to help your liver heal and regain its optimal health. Drink organic coffee. Drinking organic coffee can do wonders for your liver. Organic coffee is rich in phytonutrients, which have been shown to help reduce scar tissue formation and promote liver repair. In addition to the benefits of coffee itself, adding turmeric to your morning brew can provide an extra anti-inflammatory boost, supporting liver detoxification and healing. The combination of coffee and turmeric can also help reduce inflammation in the liver, aiding in the recovery process. Hydrate with water. Proper hydration is crucial for liver health. Drinking at least 1 liter of water daily helps thin the blood, promoting the efficient production of bile, a digestive fluid that plays a key role in liver detoxification. Staying hydrated also helps flush out toxins from your body, lightening the load on your liver. Water is essential for overall body function, and it's especially important for liver health as it supports the liver's natural detoxifying processes. Eliminate inflammatory oils. Many inflammatory oils found in processed foods, such as corn, canola, soy, and margarine, can contribute to liver inflammation and damage. It's important to eliminate these oils from your diet and replace them with healthier options like extra virgin olive oil, butter, and coconut oil. These healthy fats are not only better for your liver, but they also promote overall liver health, reducing the strain on your liver and supporting its function. Incorporate sulfur-rich foods.